Hello and welcome to Local Health Now with Guthrie. My name is Christina Episcopo, and our guest today is Dr. McClintic. Hello and welcome.
Hi, how are you? Thanks for having me.
Yeah, thank you. Today we're going to be talking about cholesterol. Now, can you tell me some warning signs of high cholesterol?
Unfortunately, there aren't really many warning signs in the vast majority of people. The only way to know if your cholesterol is high is to get a simple blood test. Really, you have to see your doctor and be screened for it in order to know whether you have high cholesterol or not.
Okay, and so for those who may not know, are you only able to go to a doctor to test for high cholesterol, or are there any other ways of going about it?
It's not something you can go to a pharmacy for and have your blood checked, but it's a simple, common, inexpensive test that can be ordered by primary care doctors or other types of doctors for screening, and it gives a lot of information about cardiovascular risk.
And then once you find out that you have high cholesterol, how do you manage it?
The first and most important thing that we always talk to patients about is lifestyle modifications. So things like maintaining a healthy weight, trying to do regular exercise, avoiding really high fat content foods, saturated fat and trans fat at least. And then we also manage it with medications in some circumstances. So we always start with the lifestyle stuff, and then if the risk of the patient is high enough, then we may recommend medications to try to lower the cholesterol and lower their cardiovascular risk.
Okay, and then finally, what are the actual risks of having high cholesterol?
So cholesterol in the blood can build up plaque in arteries, in various arterial systems, like the heart, but also in the brain and other areas of the body. So high cholesterol is a risk factor for the development not only of heart attacks, but also strokes, peripheral vascular disease, and other cardiovascular disorders. So it's a very important thing to know about, and similar to hypertension, like I said before, you can't really know that you have it unless you get it checked, and you won't know your risk unless you get it checked. So it's a very important thing to follow up with your doctor about.
Awesome. Well, thank you so much for all of this information today, and thank you for joining us. Once again, my name's Christina Episcopo with Local Health Now with Guthrie. We'll see you next time.